Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about hypertension. Worldwide, there are about 1.5 billion folks who suffer from hypertension. And every year, 7.5 million folks die because of hypertension. And in this country, as I stated in previous shows, 76 million folks suffer from hypertension, and some 67 million folks suffer from what's called prehypertension. And now as far as in this country, it is said 46,000 people could have been saved every year from dying if the blood pressure were properly controlled. Now, I've gone through a whole bunch of stuff. Now, in this segment, I'm going to begin to talk about the so-called end organs, which are the brain, the eyes, the heart, and the kidney. Because the kidney is really the #1 organ most responsible for the development of hypertension, and also the organ that's most important in the treatment of hypertension, I'm going to begin to talk a little bit about the basic of the human kidney so that you understand how does one go from hypertension to having kidney disease because of it. I'm going to detail that because you have to understand that there are two systems in the human body, the so-called low-flow system, which is the venous system, and the high-flow system, which is the arterial system. Now, the arteries have different sizes, etc., throughout the body that basically carry blood and oxygen to perfuse different organs. Now, the way the kidney gets sick, first of all, I think last year, it was a couple of years ago, I did a series of shows on kidney diseases. It may have been 2 years ago, and I'm not going to go through that again, but I want to give you an idea. How do you go from being hypertensive and developing kidney disease because of it, and subsequently wind up, many folks wind up with end-stage renal disease requiring dialysis? Well, throughout the body, when you have a vessel, in this case an artery or arterioles, or no matter the caliber of it, it's supposed to be pristinely smooth on the inside of these arteries, and no matter the size of it. The very fact that the pressure becomes elevated within the arteries, no matter the size of the arteries and the high flow system, that is the reason why you're beginning to develop an abnormality in the first part of the wall of the vessel, the so-called intima. Just the elevated pressure itself within the vessel, that begins the process of abnormality, causing an aberration to occur somewhere inside this vessel. And because of that, the smoothness in that part of the vessel is gone, and then debris and other material begin to be trapped in the area of the vessel that's no longer smooth. That's the beginning of plaque formation. Let me repeat that. Just the height, the fact that the pressure is too high inside that vessel, no matter the caliber of it, and the high flow system, that then prevents, that causes an abnormality to develop in the intima of that vessel. Once that intima is no longer smooth, then it can trap debris and other material that's passing through non-stop through that vessel to be taken out by the kidney, etc. Because it's no longer smooth, then some of that material gets stuck there, developing a nidus. The very first deposit is the nidus. And then things pile up on top of one another, and you develop plaque formation. There are lots and lots of reasons why people develop plaques inside blood vessel: diabetes, high cholesterol, chronic inflammatory processes, etc. I'm not talking about that. I'm talking about blood pressure. That's how the process begins in the vessel. Now, When that happens, then of course things begin to happen to the kidney, and then we have ways of categorizing the different level of abnormality. Chapter 11 in this book that I wrote that just came out earlier this year, The Art and Practice of Modern Clinical Medicine. This book contains a tremendous amount of knowledge as it relates, information as it relates to modern clinical medicine in the 21st century, not only in this country but throughout the world. And it has 136 chapters, 889 pages, something like that, and I wrote it all by myself. Now, chapter 11 is on kidney diseases, okay? And what it is that we calculate the level of abnormality in the kidney in 5 different stages, stage 1 through stage 5. Stage 1 is the beginning of an abnormal process in the kidney, and that goes all the way through stage 5 when somebody actually goes into end-stage renal disease requiring dialysis / possible kidney transplant, etc. Now, there are many, many things that can cause the kidney to become sick. Of course, one of the most common problems, of course, is high blood pressure. High blood pressure. Now, as I've said it before, folks have hypertension for a variety of reasons. Part of it, they may have inherited it, but the basic issue that causing somebody to develop essential hypertension is the acquisition of a gene called G protein receptor kinase type 4 that all of us human beings have in the kidney to the same degree, the same quality, the same quantity, regardless what he or she may think about himself or herself. That's the bottom line. That's the way God created the body, and there's no getting away from that. That's it. And this research was done in this country at some major universities. I believe University of Virginia was involved, Georgetown University, etc. was involved. And since then, the same research has been done at Yale using rats, etc. So there's no question about it whatsoever. The gene is there now. That gene, I believe, when I started writing books in the 1990, 1983, 1992 to 93, so on and so forth, I came up with the idea that there has to be a gene that's located in the human kidney that allows us to stay alive. That was the purpose of the gene. It was a life-saving gene to allow us to be able to retain salt so as to remain alive. Our forebears, with the ambient situation that existed in Africa. And furthermore, I detail in this book as well the travel that the early men took traveling. Believe it or not, you can't make this up, driving on, not just on boat, but on a raft, traveling over the sea to get from Africa to what is now the New World. It's an incredible feat how these things happen. And you can just imagine the trouble that folks had to go through to get there, and then the exposure to the heat and inability to find water to drink. Well, salt has to be retained, because whenever you retain salt, you retain water with it. That then prevents collapse, dehydration and collapse, and death. And also I describe in this book, when you go back and read the horrifying history of the slaves that were brought and chained to the New World, packed like one packed sardine in the bottom of a ship, no air condition. You have to understand, some 12 million folks die during the travel between Africa and what is now the New World as part of this horrible, cruel, evil history that happened as part of the world. I mean, there are a lot of evil people, there are a lot of evil animals in the world, but to the best of my knowledge, you have to admit that the human person has to be one of the most evil. Look at what the people did to the Jewish folks. 6 million of them, I believe, die in concentration camp. When you look at those pictures, a horrifying thing. How can one human being, there's something like that to another human being? It is incredible. The stuff that has happened in history. People injected folks with syphilis just for the pleasure of seeing that the syphilis will affect certain organs in their body, etc. I mean, it is horrifying. When I write these things in books, people get upset because they don't want to be reminded. I'm a writer. I have to be truthful about history when I write it because I expect people to read the book. I don't want them to. I've been writing books since 1992. I'm yet to get a phone call or an email or a letter from anyone, anywhere here in this country or around the world saying that Val, you say something that I disagree with that was not quite true. And I dare you to do that by looking at this book, 136 chapters. I go to great length to be truthful. In the process of being truthful, some folks may have gotten offended because they don't want to hear these things. It's not my role to offend people. What's interesting about it, because I'm a black man, I say things that some people might have objection to, but if a white person who has happened to be a liberal say the same thing, he or she get praised for being a truthful liberal. But me, if I say the same thing, the exact same thing, write it the same way, speak it the same way, because I'm a black male, automatically it has a different connotation that somehow I dislike some folks. Hogwash. I have nothing to do with it. I dislike no one. I'm just writing. I'm as much of a legitimate writer as anyone else. Granted, I didn't take any writing course in school, but I'm not going to apologize for that. Granted, nobody ever taught me how to write books. I learned that on my own, but I'm not going to apologize for that. That doesn't diminish my ability to write than anyone else. Suffice it to say, this is history. All the stuff that I'm telling you, you can go on the internet and check it out. It's all there. But they don't blame the internet. They're not upset with the internet that put the stuff there. But if I put in the book, oh my God, Val is being blah, 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 blah. Nonsense. The fact is cruelty. I have not been attacked by a non-human animals in my life. Politically, socially, racially. And yet I've been attacked hundreds of times, thousands of times by human who hates the color of my skin, who also hates the fact that God gave me a brain that allows me to be where I am. And they find that offensive, that somebody with my poor background would have gotten to the level that I am. And some people take objection to that, but that's their problem. Let's go and talk to God about that. The fact is, I said to myself, how then I personally experience what I experienced in Haiti, survive? Once I became a scientist, I began to look into that. Yeah, because I experienced working 110-degree temperature, barefooted, bareback, in the field for 20 cents a day, 8 o'clock in the morning to 5 p.m. for years, not just as a summer thing because I was on vacation from school. This was a job. That's what I had to do to survive. When my mother passed, I had nowhere else to go. And I never begged anybody. I wasn't going to beg anybody for anything. So I did what I had to do to survive. So when I became a physician, first of all, you have to understand, before I became a physician, I was able to use this brain that God gave me, working in the laboratory, to create this incredible research that I did at Brookdale Hospital in Brooklyn, that I used methotrexate in rats that proved that methotrexate decreases the production of antibody. And the rest is history. Every time you turn on the television right now, you see all the biologic. I didn't create the biologic, but the basic research, I did that. I was the first person in the world to use methotrexate in mice to show that it decreases the production of antibody. When this was duplicated in human, it was documented that I was correct. And then methotrexate is being used as I speak all over the world to treat all sorts of rheumatological problems. It was because of the toxicity of methotrexate that it has, the powers to be people decided to go into the laboratory and create by recombinant DNA recombinant technique, create all this biologic that you see on television, treating Crohn's disease, psoriasis, this and that and that and that, all that stuff. But the original idea came from here. I was not a doctor. I was just a laboratory supervisor at Brookdale Hospital when I did that. In fact, that's what helped to get me into medical school. So when I became a physician, I came up with a lot of ideas. What's the big deal? I've written 24 books. I have a 30-page resume. There's a bunch of characteristics in there that show stuff I did that were all original for me. People are dying right now, waiting for me to die so that they can take credit for all the stuff that I've done. And people object to the fact that I was the one who did these things. You never see anybody inviting me to Washington, D.C. whenever they're having their AIDS stuff every year, and yet you name me one individual in this country, not a group, but an individual who've done more to help the HIV epidemic than I did. And I'm not even an AIDS expert. I don't consider myself one. And yet, I came up with the idea of male circumcision to decrease the incidence and also death from HIV/AIDS. I did it on my own, right on my kitchen table. I wrote the article on my kitchen table, and I made the observation right here in White Plain in my little office by myself. And the rest is history. But they don't invite me. They don't invite me. In fact, one gentleman called me last year when he was getting an award named after me to apologize that he sat for years on the president's committee for AIDS in Washington, D.C. whenever they meet, and people were fighting to steal the idea of male circumcision after it was their own. He called me to apologize, to say had he known that, he would have fought these people off, because he sat for years on the committee, and people were fighting, pretending they're the one that did this. And I'm right here in White Plain. I'm still alive. He was shocked when he looked me online. He called me to apologize that had he known, he would have fought these people. They're still doing it right now. Stuff they didn't do, I did that. So the same idea I came up with, that you have to be retaining salt in order to retain water and expand the intravascular system for the blood pressure to go up. I said there has to be a gene that allowed that. There's no way the human race could have survived the circumstances that existed in Africa if they didn't have such a gene to retain salt, because water is very scarce in Africa. That's all. It was an idea. The most incredible thing that has happened in this world just came from somebody's head in a passing moment. It's not a big deal. I've done dozens such things. They're all listed on my resume, and I put a red asterisk right next to them. And I'm not going to sit here detail all of them to you. That may sound arrogant. That's not my point. The point is that it turns out to be correct. So the basis, therefore, for essential hypertension is salt retention. That's now an accepted fact. And then once you have the blood pressure becomes elevated, inside the vessel that are perfusing the kidney, because the pressure is high inside this vessel, it causes an aberration in the wall of the vessel, which then begin the formation of plaques. The plaques narrows the vessel to the point where blood cannot be delivered properly to the kidneys. And the kidney has a network called glomeruli. That's the network that provides nutrition, as it were, for the kidney. That's right, for the kidneys. And if you can't perfuse the kidney, can't perfuse the glomeruli without having any pain, without feeling any pain, the glomeruli are dying. They're dropping out, dropping out. Because they're dropping out, they're dying. You can't carry oxygen to them. So therefore, you wind up with different degrees of kidney disease. And ultimately, you wind up with kidney failure, requiring dialysis or transplantation, renal transplantation. That's the basis. That's the mechanism. The only two other conditions that can cause hypertension is pheochromocytoma or renovascular hypertension. Total, the two of them represent about 3% of the whole thing. So 97% thereabout of cases of hypertension, regardless who has it. And everybody else who have hypertension, it doesn't matter what they think of themselves. They have it for the same reason, besides those two that I just mentioned to you. And that is where the problem is. They don't want to be, they don't want to accept that they have hypertension because they inherited a gene that started out of Africa, but the human race started out of Africa. So that's the reality as well. So society, the modern society, nobody wants to be associated with Africa, and yet without Africa, the human race wouldn't exist. Research has been done that clearly documented every single human being is African to a certain degree. All you have to do is let somebody get access to your DNA. They can prove to you, in fact, where you came from. They can trace you back all the way, God knows what, millennium away, they can trace you back. And that has been done. So this is nothing that hasn't been done. People don't publicize it on television because those very same people think they're superior to Africans, so therefore, by discussing these things openly on television, this is an admission they're also partly African. And they wouldn't do that because they have this pseudo sense of superiority, which is nothing but a psychological abnormality. Whenever somebody thinks you're superior to another one, you got a psychological problem and you need help. The number one psychological disease in the world is racism. That's right, racial discrimination. That's the number one thing. So I'm not a psychiatrist, and I'm not here to demean anybody by giving them disease they don't have, but in my view, and I say that in this book, the number one disease in the world is not heart disease, it's not kidney disease, it's not hypertension, it's not HIV/AIDS, even though those are quite common. It happens to be psychological abnormality or people thinking they're better than somebody else. That's the number one problem. And the reason why you don't see a whole lot of that being discussed openly, because some of these people who have the power, they know how to discuss it, themselves carry that abnormality. So therefore, they're not going to tell the truth. I don't have such a problem, because I'm a victim every single day. And I'm not a victim because I don't have $1 in my pocket. I do, but I'm still a victim of racism every day. So therefore, that's how the kidney problem begins. It starts from stage 1 through stage 5, which is the more advanced stage, because you're losing glomeruli. There's another part of the kidney, is the tubules. So the tubules and the glomeruli, the tubules is the filtering mechanism for the kidney. The glomeruli is a feeding mechanism for the kidney. And you will have no pain. You'll be walking around having kidney disease, you don't know anything about it. Every day you're losing glomeruli, every day you're losing glomeruli. And then one day, out of the blue, simple urinary tract infection, bango, your kidney fail, because it can't handle the stress of an ordinary urinary tract infection, because underneath that, you have a diseased kidney you didn't know, because you don't have any pain when you have kidney disease, because you have hypertension or diabetes or high cholesterol, whatever, that was killing your glomeruli you didn't know. And it takes a simple thing to trigger the process, and then it fails. You may be walking on Tuesday with a okay kidney, passing urine, etc. By Thursday, you can't pass any urine because the kidney failed, just like that. A simple illness can cause it to go out of whack. So that's how the situation is. If you had pain, that would trigger the fact that you're having pain, you go to the doctor. But since your blood pressure is so high, you got to understand, a little bit more than between 28 and 30% thereabout of people with hypertension in this country are being treated. And those that are being treated only to that degree that they control their blood pressure. Even those who do go, somewhere between 28 and 30% have getting the pressure controlled properly because of issues that I have discussed before. They're not taking the medication, they're not following the doctor's advice, and the doctors themselves, some of them don't prescribe the proper medication because of different ethnic groups. The only medication that is universal is a thiazide diuretic. That's universal for everybody who has hypertension. The second and third, you don't have to believe me, it happens to be correct. The second and the third and the fourth, they're different. That's where the ethnic differences comes about, because there are different medications that simply will not work in a black person, so why prescribe them? And the classic example is an ACE inhibitor. I mentioned them before. They're great medication for a lot of other stuff, but you have to have high renin for them to work. Well, black folks have low renin. All non-Caucasian folks, no matter what they think of themselves, have low renin. All of them, Asian, Latino, black, no matter what they think of themselves, they have low renin. Only Caucasian folks that are not mixed with anything immediate mixture of racial has high renin. That you could use an ACE inhibitor to block the renin, because this is the mechanism through which it's going to work to lower the blood pressure. You have to block the renin. Well, you ain't have enough renin for it to block. By the time you have high renin, it's because your kidney failed, then you can't use an ACE anyway, because the potassium will go up. You understand the story? So therefore, you must know these other medications, like I talk, like an AB, like you could use an AB, you could use a alpha blocker like clonidine, etc. You could use a calcium channel blocker. Those will work, no, and anybody, doesn't matter who they are, they will work to lower blood pressure, but they will not work, ACE will not work on a non-Caucasian person, okay? So therefore, you have to know these things. You can't just don't know this stuff. And unfortunately, I hate to tell you, this stuff is not being done. An article just happened in the New England Journal last week. They were talking about a whole bunch of stuff. They brought the same concept of ACE inhibitor that I'm talking to you about. This is the science. I didn't create that science. I don't have a monopoly to it. This is it. That's the science. You can look it up any way you want to. So not putting it into action every day in the treatment of patient just doesn't make any sense whatsoever. So now that you know that the kidney can be affected by blood pressure, every time you come in contact with someone with high blood pressure, you have to go about not only treating them, you have to begin to evaluate the kidney functions to find out how much, if any, the blood pressure has already affected the kidneys and to what degree. That's important because you have to organize your medical treatment by way of blood pressure medication based on the degree of kidney malfunction that's already existed. You have to know that. All right? So that's the story. And then next week, I'll again continue to talk about how you go about evaluating the kidney in someone who's hypertensive. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.